So let's see a few points on SLE pathogenesis. Pathogenesis in SLE. Consider this is one of the cell of the body. Okay, one of the cell of the body. Main pathogenetic theory is that in SLE, this has genetic component, that is nucleic acids. So when cell dies, it goes for apoptosis without causing any problem to the body. But what happens in SL is that, so normally when the cell dies, complements are the one which marks them. So this mark is identified by macrophage. So macrophage comes into the picture and it eats the whole cell without causing any disturbance in the homeostasis. But what happens in SL is that this mechanism, that is when the cell dies, complement tag will be there. This complement tag or the mark identified by the macrophage, the system is abnormal. So when the cell is about to die, so their nucleic acids will be exposed inside the cell, and if this nucleic acid is exposed outside the cell during the cell death, the complement which is there, if it is abnormal, then what happens is that this macrophage will identify this nucleic acid or the cell which is undergoing apoptosis as a foreign tissue. Instead of taking it as a phagolysosome and digesting it, this mounts an immune response. So here, physiologically, this cell was acting as the cell which clears this cell, or the cell which clears this autolyzed or apoptotic body. Instead of that, it tags an immune response acting as an antigen presenting cell. Activates T cells. This T cell activates B cell. As you know, there is a co-receptor as CD28. So this B cell produces antibodies to these antigens. These antibodies are thrown out in the blood. And these antibodies attacks these cells. So in the blood tissue there is free antibodies and antibody complexes are there, which are due to an abnormal cell clearing process leading to an immune response to the nucleic acid component of the cells, leading to free antibodies in the blood and antigen antibody complexes, which leads to spectrum of symptoms in systemic lupus erythematosus. Okay, and what causes these things? So there are many risk factors. Many risk factors are there. One is that the estrogen itself. Hence it is more common in female and age group of 20 to 60 years. Okay, there are many risk factors are there. Some important is estrogen and abnormal C2 C3 or absent C2 C3. Complement deficiency is one of the important, and one gene known as TREX gene, and also X chromosome, that is, more the number of X chromosomes in a disease or in a cell, more it is susceptible for SLE, such as Klinefelter syndrome, which has more risk of going to SLE than Turner syndrome. Even though Turner is female and Klinefelter is a male, Turner is X0, but here it is XXY. Hence, Klinefelter syndrome is more susceptible to SLE. Thank you.